They say knowledge is power, but you need the wisdom to understand what this actually means. Welcome to the Decoding Health podcast. I am your host, Dr. Urban A. Kiernan. Each week, we will share the stage with renowned experts as we dismantle the black box of knowledge and unravel the complexities of science and its practical applications in our daily life. This show is committed to illuminating topics ranging from personal health and wellness to cutting-edge biopharmaceutical advancements and beyond. Let's get started. Welcome back, followers, to another exciting episode of the Decoding Health podcast. As always, I'm your host, Dr. Urban A. Kiernan, bringing to you another exciting topic in naturopathic medicine. Joining me right now is Dr. Neil Morris, naturopathic medical doctor based here in Mesa, Arizona. He's got a medical journey that spans over 25 years, beginning in pain management and now evolved into a wide array of restorative health therapies and treatments that you may not have actually heard about before, but this is some really exciting technology that we're going to be talking about right now. So without further ado, Dr. Neil Morris, welcome. Oh, and by the way, just for all full disclosure, I do Brazilian Jiu-Jitsu with him, so it's he's a fun guy to roll around with. Wink. I got to throw that out there, but nonetheless, it's welcome to the show. Please enlighten the audience a little bit about you and your journey in getting into where you're at today.
So I began in medicine actually as a nurse. So I graduated in 96 with my bachelor's in nursing degree. I went into nursing. I loved the ICU, intensive care, CVICU, surgical trauma, things like that. When I did my undergrad, I played college football. So I ended up having chronic neck pain that turned into headaches that got worked up for high blood pressure and all these different types of things. And then finally I was told, it's like, oh no, it's all from your neck and we just need to do a cervical fusion on you. And I was like, and I'd already been in medicine for a little bit by then. And I'm like, that can go so many bad ways. You know what I mean?
Yep.
And usually what happens with the fusions of the spine is you fuse one and then you come back a couple years later and then you fuse the other one above and below and you end up for the entire area fused. And then it usually helps preserve some function, but a lot of people don't even end up out of pain. So that's why I was like, I don't want to do that. I end up going to a chiropractor. A chiropractor could keep me out of pain for about 1 to 2 weeks. And then finally I stumbled across this thing called a naturopath. Again, I'm working as a nurse, didn't know what a naturopath was. And he was like, you know what, you can keep going to a chiropractor, but I really think you would benefit from doing some injection therapy that would heal that area. And I was like, I knew what my options were. So I was like, why not? So I did it and I was literally pain-free for 3 months. And I was like, what is this witchcraft? Okay, because why haven't I heard of this before? Why don't I know more about this? I was already in medicine for about 8 years by that time. It was right around 8 years. And I was like, all right, I need to learn more about this. What's the best route for me to go to get the best education to be able to do it the best? And once I looked around, other than becoming an orthopedic surgeon, then if I'm going to become an orthopedic surgeon, why would I do injection therapy?
Yeah, you're bound by those. You're in that game. You're bound by those rules.
Yeah, I'm like overqualified.
Well, I'm not going to say overqualified. I would say you're differently qualified.
There you go.
Yeah.
There you go. So at that point, that's why I went into naturopathic medicine. I went full in, all about the injection therapies to heal the areas of where injuries were occurring. And I wanted to learn more and more. That's why I went that route. Now I ended up learning much, much more and diversifying more, but that's really what I did. That's what I focused on when I did my residency. And then during the residency, we saw like a group of people that would do amazing, with certain injections and some that wouldn't. And then we noticed that when people's hormones are balanced, they do better. So then we learned, then we were like, all right, we have to learn more about hormones and stuff like that. So that's kind of how the practice kind of started to develop. And as more and more technologies come along, I just keep putting myself out there because I do firmly believe that the cutting edge medicine is with the researchers. And if you're not constantly, by the time something's in a book, it's old, right?
Yes.
The information, it's old information. Like, that's what I tell you, everything you learned in medical school, it's all old. Even a paper, you tell me, how long does it take to publish a paper?
The normal publication cycle?
Yeah.
The fastest I've ever been published was in 3 months.
That's fast.
Oh, it's super fast. It was in Feb's Letters back in like 2002. Some of those cycles with the revisions going back and forth a year,
Right.
just to get into publication. And now what you're talking about is going from the R&D world into mainstream medicine. That's often decades.
Yeah.
You know, like HbA1c, people have known about that forever. And it was just, for the longest time, it was just something that was kind of thrown in there. The diagnostic aspect that's used today for HbA1c probably took almost 20 years to build that data set before that was accepted for a diagnostic designation on that.
And that's why I was saying, like, unfortunately, a lot of doctors aren't you have to be continually educating yourself and continually kind of picking these researchers' brains. Because, like, and again, another conversation we've had before, we've talked about this, just cholesterol testing and what's the best testing. And the best testing is not even available to us.
Oh, absolutely.
Absolutely. So it's like, you're like, so we're just kind of the physicians that are seeing the patients are operating with the best information that we have. But if you're not constantly updating yourself with the newest technology coming out, then you don't know.
Yeah.
So that, for instance, another thing that I'm doing also right now, there's I'm doing 2 fellowships. One's in stem cell therapy and the other one's in anti-aging. But that's just to stay on top of the new information.
Sure.
So.
Sure. No, awesome. And in terms of medical school, like, you didn't go to a traditional medical school.
I went
Where'd you
to
go?
when I went to it, it had a different name, but now it's Sonoran University. It was Southwest Naturopathic School of Medicine whenever I went. It is a naturopathic medical school. It is 4 years. So we have 4 years. The first 2 years are very similar to a DO program. I spent a year in the cadaver lab, with the bone saw. We started from full everything to, we cut open the skull and pulled the brain out and, everything. And the lab test of saying, identify this nerve, and you're like, and you have to go and show it, things like that. It's pretty intense. Then, and licensure is different from state to state. In the state of Arizona, we have a very broad scope. So not only do we have to be able to do all the naturopathic stuff, but we also have to be able to do all the pharmacology stuff, and we take a board certification on that too. We're actually allowed to do acupuncture. I don't do acupuncture per se. I did get my license to be able to do it. But because I don't do it day in and day out, I don't do it. I believe you double down on what you know best, and then you refer out for what you don't. So our scope is very broad, and then it's up to the naturopath to really, in the state of Arizona, again, it's different from state to state. It's up to that individual naturopathic medical doctor to decide what they want to really hone in on and own. Some people stay broad, some people hone in on this stuff.
Gotcha. And you said you need to double down on what you do best, and that's normally basically what you're most passionate about. And because of your own personal story with neck, that's the initial injection type therapy is what brought you in, and obviously you're going to turn around and focus on that. So let's talk a little bit more about, like, taking needles and shoving them into people. So just for all transparency, this man has poked me with needles.
Yes.
Several times. I have a blown C6 nerve in my neck, and I was having all of the radiating pain and numbness in the thumb. And we started off with just originally, we needed a quick fix.
Right.
Okay. And then we moved into more of a healing aspect. And so in the case of healing for me, we're doing platelet-rich plasma, or PRP, which is one approach to this restorative health. But we're going to talk about something very different
Yep.
today.
Yes.
We're going to talk about stem cells.
Yep.
Okay, so let's just jump into the deep end head first here. Hopefully
Okay.
there's water. For the audience, what is a stem cell?
So stem cells, it is, like you said, a super hot topic. Most people get it wrong. When they think of stem cell, they just think of like mesenchymal stem cells, usually what they think of, or they're being told they're getting stem cell and it's not even really stem cell. So there's different types of stem cell, okay? Now the true embryonic stem cell that when we think of stem cell as totipotent, you can't actually do in the United States.
Correct.
Okay, it's illegal. I think it's illegal as a U.S. citizen to go and do it outside the United States and come in. Is that correct?
That is correct. That's
I
because
believe
that was put into place under Bill Clinton, I do believe.
Yeah.
If you remember Christopher Reeves,
Yes.
the Superman who broke his neck doing equestrian, there was a tremendous, or still is a tremendous amount of embryonic stem cell work going on over in Israel. It was huge advancements on that, and he wanted to go to Israel just so he could get off the ventilator and breathe on his own, but he couldn't do that because the moment he came back to the United States, he would be arrested. So that's a very, very tragic story regarding the rules and regulations around therapies, and I understand the ethical implications when it comes to embryonic.
It can
stem
turn
cells.
in. The beauty of embryonic is it can turn into anything.
Anything, yes.
The downside of embryonic is it can turn into anything. Okay, so in other words, it could. You see what I mean?
No,
so literally, you could it could be a huge cancer tumor. Okay, so there has to be, there does have to be a lot of guidelines in place. Also, again, you could potentially like clone people, literally. You know what I mean, type of thing.
And it is embryonic, so it comes from a early stage fetus.
Right, and there's that also the ethical issue from that too. Now, there's that, and which we can't really do in the United States. And also, if you were to do it outside the United States, don't tell anybody.
Okay. Yeah, that's a tough one. But
you know what I mean? Like, obviously, you better not tell anyone. I don't recommend it just because of, if someone was asking me, what are your thoughts? I'd be like, you're right. Right now, there's just not enough information, at least that I know of. But again,
we're isolated.
Maybe if you went to Israel and you're doing that cutting edge, they could probably do it under very controlled and they'd probably be fine.
Yep.
I just don't know enough information about it. Now, the next area of stem cells are the pluripotent stem cells. The beauty of pluripotent stem cells are they have the ability to turn into almost anything, but they generally won't turn into like a cancer or a teratoma or something like that.
Gotcha.
Okay. But we haven't done a lot of research on it until like in the last 10 years or so. And one of the things that fall into that class are V cells, and it's VSELS, which is very small embryonic-like stem cells. And these stem cells, which is super interesting thing about them, is they basically help grow us from, this to a baby. And then sometime around the period when we're born, they deactivate and just lay dormant in your system. And they just will reactivate with some type of massive trauma for short periods. Generally, there's argument debate, 24 hours, 48 hours, something like that. And then they go dormant again. And they have the ability to heal pretty much anything that goes on. Now, if you were able to keep them active longer, that's where, the more and more stuff has been done. Now, the next layer of stem cells of what you're looking at is like the germ layer. Germ layer stem cells is the most popular one is mesenchymal stem cells, MSCs. A lot of people will also use a thing called Wharton's jelly, which comes from the umbilical cord, that is rich in mesenchymal stem cells, MSCs, but they'll sometimes opt for the MSCs because when you order those and buy those, it's on the products that I use when I use it, or used to use it a lot of, it tells me my exact stem cell count in that MSCs.
Sure.
Where in Wharton's jelly, you don't have a stem cell count, but they say it's in there. The thing about Wharton's jelly that's great, and again, it's a little bit different, is that it has other types of products in it other than just the mesenchymal stem cells that help grow tissue. Now, here's the thing. This is the caveat about mesenchymal stem cells that people don't tell you, is it's for, and this is where the FDA comes in too, it's for like and like. So if you're trying to use it for something neurological or something not, bone, tendon, ligament, muscle, it shouldn't work at all. Like that's what it's for. Because you have different stem cell groups, that's what it turns into or will help grow.
Gotcha.
Type of thing. Whether, now there's a big debate on MSCs, whether the ones you put in actually do anything or does it recruit your own to come there and stuff like that. So there's a big debate on that. I've seen research to support both sides. In the past, I've had great results using MSCs and actually think they're a great product. But again, we have started using V cells a little bit more just because the results are similar or better. And the difference between the V cells and the MSCs is the MSCs you're getting from a donor. The V cells we can get from you. And I always like the idea of being able to use your own body to heal yourself.
Gotcha.
And then you have the last layer of stem cells, which is, the single tissue, skin, nerve, stuff like that, which in general, we just don't really use that much.
Gotcha. And any particular reason why it doesn't fit the needs or scope of your practice, or are there limitations?
You know what? Number one, to my knowledge, nobody's isolated a product to be able to actually use it for stuff like that. And in general, whenever someone, they'll put mesenchymal stem cells or Wharton's jelly and stuff like that on the face and stuff like that. So to my knowledge, nobody has isolated a product for that particular. They just use the bigger guns per se.
Gotcha. And so in terms of a product, so Wharton's jelly, that's a commercial product that you can turn around and buy. As you explained with mesenchymal, you get a donor for that. Yep. And then, which is like a version of allogenic transplant. And there are risks associated with that.
There is.
And we'll touch
They're
on
low,
that.
but there is.
Oh, absolutely.
Yeah.
And then the other is the autologous, which we're going to be talking more about the V cells on this, in which it comes from yourself. Now, how do you harvest this? Either from me or from a donor? And from a donor, do you need to do some sort of match screening like they do for bone marrow?
Are you talking about the Wharton's jelly MSCs or are you talking about the V cells? Or both?
Well, with MSCs.
So MSCs, really, there is no matching, okay? We're buying them from generally a company. Now, the FDA has done a good job about shutting down a lot of there used to be a ton of companies out there, but there was a couple years back. It was June, I want to say it may have been 2020 or 2021, I forget exactly. But so the FDA did come through, and I believe, like I said, it was June of 2020 or 2021, I forget exactly the year. And they did pull out a lot of the stem cell companies out there that were just kind of just throwing stuff and selling it to you at a great price. After that went through, you had to have some type of association with the FDA to be able to still sell stem cell.
Gotcha.
Now, those products that remain are pretty much, they are from donors. They have to go through certain testing. Even the ones where the MSCs, a lot of them they're getting through Wharton's jelly, where they're taking the Wharton's jelly and cleansing it and cell counting it, so you can tell you exactly how many cell counts are in there. So, and I believe how they get around it is that they're immune privileged cells. So because they're immune privileged, then you shouldn't have much of a reaction to it. So because they wash it down so much.
And that's the definition of immune privileged?
In the sense of almost like a nerve cell, like how a nerve cell, the immune system should not attack it type of
Ideally,
thing.
yes.
That's kind of what I'm wanting to communicate.
Gotcha. So from a self versus non-self
Right.
host donor response.
Right.
Okay.
Right. So literally, there should not be a reaction to it. Should not be.
Right.
Okay. I've never seen a reaction to it, but I have heard of reactions to it. So again, it's always something that you bring whenever you're going to do that type of product. You should be made aware of it.
Gotcha. And then with the V cells, where you do a harvest from the actual individual, so you are donating and then turning around and receiving. How are those harvested?
So
do you have
want
to
to
go
know
through
what?
the nose or?
No.
All right.
Sorry. So it's actually a blood draw. And it's very similar to how you harvest PRP, because the V cells, once you spin it down, are found in the plasma, like you would where you find your PRP. So you spin it down the same way, and then you take the plasma, and that's where they're at. And then you basically, and now this is a technology I did not develop. I'm under an NDA so I won't go through exactly how it's done. And I'm probably going to murder his last name, but no one calls him that anyway. But Dr. Todd Ovakaski, everyone calls him Dr. Todd, okay? Him and another gentleman developed this laser and lens that actually will activate the V cells in your body, in the plasma, and then will literally stay active for roughly 3 months, to continue to heal for roughly 3 months. Sometimes longer, but in general, at least 3 months.
Okay.
So, which is pretty much crazy when you think about it. If we can take your own body's natural healing that's embryonic-like.
Right. Again, not embryonic, but embryonic-like.
Right. That's
just to
very
clarify.
small embryonic-like stem cells. Very, very different.
Yes.
So, and to be able to have those continue to heal in an area in your body for 3 months is pretty amazing.
Right.
You know what I mean? Without having to take, something from another person.
Gotcha. And as you already disclosed, this is not technology that you yourself pioneered.
I did not.
You went and you found it, you researched it, you licensed it.
Yep. And received certification on how to do it.
Gotcha.
Like do the treatment.
Gotcha.
So yeah, there's a certification with it.
And then obviously access to the proprietary technologies, ergo the NDA, non-disclosure agreement. That's a business thing in which don't talk about this crap or else we're going to sue your ass.
Yes.
So that's
why I'm not going to talk about it.
Yeah, but
that aspect of it.
But let's not go and leave this in terms of something like a bunch of witchcraft and voodoo.
Right.
Okay. Let's kind of talk about some of the science, obviously, within the scope and limitations of your non-disclosure. Has this been through peer review publication at all? Okay.
So here's the thing. When I first heard about it, I'm a skeptic. Okay. When I first heard about it, I was like, there's no way that this works as good as what they say it works.
Right.
And literally, I didn't want to even go out there to visit or anything like that. But what caught my eye is a couple research papers that were published on congestive heart failure. Okay, and then working as a nurse, working in cardiovascular intensive care, ejection fraction, and that's what they use to measure. All these patients, to qualify for the research, had an ejection fraction between 20 to 25%. They were all on the heart transplant list.
So can you just explain ejection fraction to our audience who might not know?
So the simplest way to say it is how well, when the left ventricle of the heart contracts, how well it pushes blood out.
Gotcha.
So if the heart can't contract properly, enough blood can't get out to the body, it backs up into the lungs. Congestive heart failure is where the blood backs up into the lungs and basically pink, frothy sputum, and you'll eventually die.
Nice. And what would be a normal ejection fraction?
So like a good ejection fraction, you look like around 60%.
Sure.
You know what I mean? That's pretty good. So, and like I said, these people were, to meet criteria, they had to be between 20 to 25.
Gotcha.
Okay. So now I would say the study was small. It was only 10, but 10 people. But they did a difference between, the comparison study was done with stem cell that they injected, and it was mesenchymal stem cell, just
Gotcha.
so. That's why people use it. So mesenchymal, they're usually talking about stem cell, or when they say stem cell, they're usually talking about it. And they did a heart catheterization. So they went through the right groin and injected the MSCs directly into the heart. And over a course of 6 months, they were actually able to increase the injection fraction by roughly 8%, which is really good, actually.
Sure.
You know what I mean? So like, that's good.
So you went from 25 to 33 or 8% of the 25?
No, 8% increase.
Gotcha.
So yeah, so from like say 20 to 28,
Gotcha.
or 25 to 33. Now, with the they did the comparison study, and now they did the V cells, and the V cells they pushed to the right antecubital AC, like right bend of your arm. Layman termed it down there.
Thank you for the audience.
Yeah, so they just put it right there, and they push the V cells through the IV. And then part of the protocol also is they put the laser over the areas that they want to help it get to. So they put the lasers in a couple different directions over the heart without giving away the protocol. And they found that there was anywhere from like an 18% to a 28% increase of injection fraction over 3 months. So they had some of these people, their ejection fractions were getting up to like close to 50%. You know what I mean? Which is,
you're not a candidate for.
you're good.
Yeah.
Like literally, you're good.
Yeah.
So when I read that and that it was published, and again, I'm the type of person where I'm like, all right, I'm not a researcher. Let someone who's a researcher read this and tear it apart.
Right.
And they're like, this looks good. And I was kind of like, I'm like, all right, you know what? I want to meet this guy. And when I met Dr. Todd, I was like, either he's crazy or he's a complete genius, and he's probably both. Because
Gotcha.
he is I think he's an MD. He got his training at Johns Hopkins back east. You know what I mean? So like legitimate, worked as an intensivist for many years, and then had been involved with lasers and stuff like that for many, many years. And pretty much him and this other gentleman developed this particular type of therapy. And that kind of brings us to where we're at in terms of just kind of talking about the therapy in general.
Gotcha. And so Ethan our tech had gone, or engineer, excuse me. He's put up a copy of the reference. So like, no, Dr. Todd, when you went to visit him, was he like in the back alley in Las Vegas?
No, he's in Carlsbad. he's in Carlsbad.
Okay.
You know what I mean? Like it's
legitimate.
Very legit.
Legit.
Yeah.
And so you went in and you were like, explain this more, and then.
So we basically said, you know what? Convince me. You know what I mean? And then he started talking, and his level of knowledge of lasers in general, and he was talking about the different nodes and how they cross and how they activate and how, the other different types of research. He was showing me some of his other research, but he was also showing stuff they were working on, and then also some videos of clients. He had, I don't know if he ever published on this, but like he had a young boy that came to him that basically was legally blind, that can, after some treatments of V cells, can now actually see, all this type of stuff. Now, is he 100%? No, not saying that, but we're talking about someone who couldn't, see in front of him, now seeing image and stuff like that. So there's all this different type of stuff that he was showing me, where I basically said, you know what? We need to bring this into our practice. Like there's so many applications for this. What we know best at our practice is more the restorative injection therapies. That's what we really know the best. That's what we brought it in mainly for. And then, of course, it did turn into, some other different things, but that's what we really, really was our focus. And and we were looking for a product that was something that was because we used to do the bone marrow biopsies, and we used to do the adipose tissue harvest and stuff like that. Again, the FDA cracked down on those, changed things up a little bit. I believe there are still a couple products out there, but I just find I was getting better results with the MSCs, Wharton jelly type products, than I was with taking it from the actual host. And I think it's because the host just got old. You know what I mean?
Right.
Versus the other ones were, what's the word? Because it's not embryonic. You know what I mean?
Right.
You know what I mean? But the other ones were basically just younger stem cells.
Gotcha. And so let's talk a little bit about this from the restorative aspect, because you've actually done this in your practice, and you are allowed to talk about some of your case studies. Now, patient comes in, they're going to go and do this. You draw the blood from just a high level of the protocol. You draw the blood, you turn around, and you
same day
interrogate the plasma with a specific laser protocol, certain frequencies. We won't get into that. Then you turn around and you take that, reinfuse the patient with that.
We
plasma.
also do, because there's a couple different ways of doing it. We always do a IV push back in with part of it. But also with what we did also is we do the local injection in the area, whether that they're having pain or loss of function. For example, one of the case studies is a gentleman who's 30 years old, jiu-jitsu practitioner, and he got caught in a heel hook, and he tore everything on the outside of his ankle. That's layman's term, medical term, ATFL and CFL. Okay, those ligaments there. And they were grade 3 tears, which is pretty much all the way through.
Yep. Normal course of action would be what?
Surgery, and if you chose not to stay surgery, you'd probably be in a boot for 6 to 9 months.
Okay.
Type of thing. He didn't want to have surgery, and he opted to do a V-cell treatment. We did the V-cell treatment on him. Within a month and a half, there was a big tournament coming through the Phoenix area. I won't say any names because I don't know.
You can say ADCC.
Okay, it was the ADCC coming through.
Abu Dhabi Combat
Club. I don't know if I can say that or not, but the ADCC was coming through, and he wanted to compete in it. And he felt great, and I was like, "It's only been a month and a half since your last injection," and I was like, "I would prefer you don't." He was like, "Well, I'm going to do it." So I'm used to that with my patients. Jiu-jitsu, MMA, they do that.
We're odd.
Yeah. You're like, I have to tell them, and full disclosure, I'm my own worst patient.
Yes, you are.
I've literally had an injection, and then 2 days later, I'm in jiu-jitsu class, and people are like, "Didn't you just get injected?" I'm like, "Yeah."
Yeah, I think the term that I used to describe you that one day was, what was it again? Oh yeah, it was fucking idiot.
I know. It's just part, I think, of the mindset is I feel good.
I've been called the fucking idiot myself.
Yeah.
So it's it is what it is.
Yeah. So anyway, when I got doctor face on, I'm telling him what is the best thing to do. He went against what I said to do. He competed, and in one of his last round, he was doing well. He did get caught in a heel hook again, and the guy was cranking on it, and his ankle was holding. He wasn't having any issue in his ankle, and then the guy reversed to a toe hold and took him out. And when he did, he felt something pop on the inside of his ankle. So he tapped, and probably should have tapped before that, but jiu-jitsu people. So he came to me, and I was like, "Well, let's get an MRI. Let's see what happens." And I'm thinking man, I told him not to. And we have that second MRI because he got initial MRI.
And so, Ethan's actually pulling up the pre-MRI.
Okay.
And Yeah, it highlights where the tears
Yep.
are.
Yeah.
And now you've got this post MRI.
Yep.
And just explain.
So in the post MRI, of course, it shows the entire ankle again, and he did have some minor tearing on the deltoid ligament, the inside part of his ankle, but the outside of his ankle was 100% healed. Now it did show like there's some strain, but literally there was someone trying to crank on it like 2 days before the MRI type of thing. But there's some strain. In other words, like it shows like irritation, but it was 100% healed.
So not a grade 3 tear anymore.
No,
not grade 2.
Not even a grade 1. Not even a grade 1.
Gotcha.
Yeah. You know what I mean? So like literally, and I was kind of like, okay.
And that was a month and a half?
That was about a month and a half after his last injection. Yeah.
Gotcha.
So like literally, you know, there's nothing there in the research to support that to happen. In other words, if you went to an orthopedic surgeon and said, hey, will this be healed in a month and a half? They would laugh at you.
Oh, yeah, no,
you know
absolutely.
What I mean? Like they're like, no. You know what I mean?
Yeah.
So it's just the increase in healing time. Could it spontaneously heal over a year? That would have to be some research, but like it would not spontaneously heal over a month and a half. It's not possible.
Gotcha.
You know what I mean?
Gotcha. And so again, just from a general overview of the protocol, you injected the patient's own V cells into the area. Was there laser light focusing involved?
And that's part of what we do also. So like that's part of the protocol is after you do the injection, you do put the laser that is also used to activate the V cells over the area of concern.
Gotcha.
You know, dysfunction, pain, whatever you have going on.
Gotcha.
That's always part of it.
And it's a single treatment then?
So our protocol is a little bit different. Okay. So we do, of the V cells, it's a single treatment. We have our own little protocol that we don't tell people, but I mean, obviously if you receive treatment, you know it. But we do more than one injection. But there's one injection to kind of get the area ready, then the V cells, and then one about 30 days later to make sure that, you know, and most people don't even need that last injection, I say, but we kind of do it just because our results have been so good. Why not just keep it that way?
Gotcha. And again, this is the example you just gave was very localized. It was a ligament issue. And that's phenomenal.
Yeah.
You know, having been injured myself, you know, ACL, that was 9 months of, which was fast for an ACL replacement, you know, recovery and everything. Again, that's where I've been called an effing idiot myself in terms of being on the mat.
Yeah. Like, what are you doing here?
Too soon. But again, in all clearance, I did not do anything that my surgeon did not clear as a part of all of that. But nonetheless, do you have any other examples from your practice that you can talk about in which it wasn't localized, it was more systemic? Because you are restorative health. And the last time I checked, you age everywhere?
Yes. So, and very, very interesting case, and was with, because there are actually, and we'll share the information, there's published data that shows that the V cells has the benefit of anti-aging, okay? Now, we recommend if someone's going to do the V cells for an anti-aging type thing, that they get some type of methylation or DNA test to kind of get a before age, and then roughly 3 months later, do at least another one. Most people don't do it. You know what I mean? Right. It costs money, you know what I mean? Each time, you're having to literally check like the DNA, and some people don't, want to do that.
Privacy reasons, I get it.
Yeah. Which I get it too. So I don't push on it. I'm just saying like, I like measurable data. So if I can get more measurable data, especially from an anti-aging perspective, I want that information.
And so between the two, because you mentioned methylation aging versus actual...
Telomeres is another way that they look at.
Okay, gotcha.
Yeah, so that's one of the ways that they can check and say your DNA age type of thing.
Yeah, and just for our layman audience members who are a telomere, I've never heard of that before. Basically, it's the ends of your chromosomes.
And the little plastic thing on your shoelaces.
That eventually wears out and
That'll
starts to
wear
fall
out.
off.
Yeah,
You know, and then everything's all frayed. Yes, exactly.
There's a
That's
little plastic thing on the end of your shoelaces that stop your shoelaces from fraying. Once they fall off, you start to really age really fast.
Yes. Yes.
So anyway, there, we got a little tangent there.
No, it's
So this patient wanted to do something anti-aging. She is a very healthy person, and she travels out of the country every year and does like a cleanse and gets full testing every year. Like every year she travels to Europe and she gets like echocardiogram, ultrasound of her liver, EKG, full complete workup.
Right.
Every year, okay? For probably about, I think she's around 20 years she's been doing that. So like I said, very healthy for any person that age.
Sure.
And she's, at the time, was 60. So during that year in between, she did 2 of the V-cell procedures. And when she went back that year and they started working her up and everything, and mind you, she was like, I don't feel any different. And I'm like, well, you didn't do any, I don't have any measurable data type of thing. She's like, I feel great, but I felt like I felt great before. So when she went back that year to Europe and started doing everything, they work it up, and they asked her, what did you do this last year? And she actually didn't say anything about me. She's like, oh, I've been meditating and stuff like that. And she didn't even think about it. And they were like, well, your DNA came back. She's 60. Your DNA came back that of a 38-year-old. Your heart function, liver function, all that looks like you're in your 30s. So whatever you did this past year, just keep doing it. And then she actually eventually did come back. I didn't know about it because she came back and she's like, oh yeah, they told me. I'm like, and I was literally like, do you realize like that's literally what those were for?
Yes.
And then she was like, oh, I didn't think about that. And I'm like,
oh, that's great.
Yeah, I know. I was like,
I think you'll get some coffee.
Yeah, exactly. I was just like, so to me, that's huge.
Right.
It would have been nice because they actually wrote a paper on her and published it over in Europe. It would have been great to got my name in on that paper. But that being said, knowing that I was a part of that protocol, and like I said, she put herself in a position of healing. She eats well. She, does
They had a
tons
good
of
base
stuff
to begin with.
Yeah, she has a great base to begin with. So that being said, we just helped kind of push it in that direction. So yeah, that to me was a great case that actually took, over a year to find completely out about because of the treatment, then her traveling, and then her, she didn't immediately come back and tell me because she didn't make the association. So that was a great case. Now, another huge case, and I would say probably was the most impactful thing to me in 2023 was a young boy that we treated, and he has cerebral palsy, okay? Now, there has been, Dr. Todd, I believe, has treated several people with cerebral palsy with great results.
Could you kind of describe, if nobody is familiar off the top of their head with how does cerebral palsy manifest within a patient?
So generally what happens is during birth, something occurs that decreases oxygen to an area of the brain in a child. And it causes, it can be a variety of different things. It can be, a lot of times there's something muscular involved, and it can be like, the common thing is you'll see them kind of where they can't put their heel to the ground, can't open their hand. Then it can also affect speech.
Right.
It can affect anything all the way up to swallowing and cognitive, depending on which areas of the brain are infected.
Right.
And then usually always affects something at least muscular. You know what I mean? And this young boy, he came in with his elbow actually like at roughly 9 degrees, not really able to open his left hand, and could not put his left foot to the ground. Now, I would say his speech was not affected. So in terms of cerebral palsy, I would say that he did not have severe cerebral palsy, because I've seen some very severe where literally it's a hard time understanding what they're saying or no speech at all, to him per se.
Right.
And he has a great physical therapist, and I was able to work with, and we treated him with one round of V cells, and we focused the laser over the areas that were impacted in his brain to help address the motor function. And after one treatment, he actually had just amazing results. And literally, I was given a video from the family, and actually we're going to show it.
Yeah, we're showing it actually right now.
Yeah. And if I didn't tell you the kid had cerebral palsy, you might miss it. Like it was, so like when I first saw the video, like I literally, like the hair raised on my arms, I was just like we just changed this kid's life.
So in the video, obviously, audience, so you can see it if you're on one of the just pure audio versions of this podcast.
Yeah.
The young man is the boy.
So he is playing catch. Okay. So one of the things that when we do V cells, one of the things we always ask him is like, what's your intention? He said, I want to be able to catch a ball with my left hand, and I want to be able to dribble a basketball. That's what he wanted. In this video, he's catching a ball in a baseball glove with his left hand. And notice also in the video, his left heel is going to the ground. That did not happen before he did the V cells.
Gotcha. And normal traditional therapy for cerebral palsy, correct me if I'm wrong, is intensive physical therapy, regimen, varying degrees of success.
Yep.
Correct. Again, it's a lifelong issue.
Yeah.
In terms of being able to do a tailored protocol for this young man, are there like MRI scans that can be done?
We take generally we don't have to do any because there's so many done with someone who has cerebral palsy. They do so much imaging when they're young to, basically make sure, number one, that it's no longer occurring, you know what I mean? That the blood supply is back into the different areas of the brain.
But the damage is already done.
The damage is already done, yeah. So they're looking, they generally have all had a couple CTs and a couple MRIs, and I utilize that to basically target where we're treating.
Gotcha. So you knew exactly where you were going for this particular case.
Yeah.
You did it. In terms of time lapse from treatment to video.
So the video, I think, was roughly a month after the treatment. Now, he had significant change within a week. Here's something I want to say. Like the V-cell, I would not say just do that V-cell alone. You need the physical therapy.
Of course.
Because as things start to reconnect, there's still those muscles have to be taught because they haven't been able to be used. So you need that physical therapy in order to be able to get the full benefit of the V-cells. I would not just recommend just doing V-cells and being like, peace out type of thing.
Gotcha. And just for clarification, this particular case study in the images that we're showing here that you're talking about, Dr. Morris, this isn't being promoted as a cure for CP, but not by any stretch of the imagination. So don't take it that way. Here is a treatment option that may or may not provide some additional relief, but this is a very nice, heartwarming study of
whatever you can do
success.
To increase quality of life. That's the way I look at it. Whatever you can do to increase quality of life. I am just started working with another patient. I don't have any permission to talk about this patient yet. We just started not too long ago with this month. And they are already seeing they saw changes within the first, I think 4 or 5 hours. And it was the physical therapists who I'm coordinating back and forth with. We're going back and forth and they're like, yep, already increased this, all the different areas. And that the parents are very happy with the results already. Now it's very new. Again, as it goes in. I did a much better job with this case documentation.
So you
before pre documentation,
Yeah.
because like for the other gentleman that we showed the video of, I don't have a before video of him.
Sure.
It would have been amazing to have a before video of him, but I have the after video of him.
Right.
So for this particular person, we do have a before, and then we'll, as long as everybody agrees, do after, and then present it as like a case study. Also.
Absolutely. Yeah. I think this is something that requires, additional level of scrutiny. Like
Yes.
you have to do with
Absolutely.
science.
Well, can I replicate it? Right?
Oh, absolutely.
You know what I mean? Like, and everybody, there's different levels of different disease processes. Will it work the same with this level as this level? And you know what I mean? And I don't know. I don't know. This is for all, purposes. This is experimental.
Yes.
I make no promises. I always tell people I expect good results because I continually get good results, but I make no promises.
Right.
I just want to be very clear about that.
And that's the responsible thing to do. So again, though, for our audience, nobody is saying that this is a cure for anything. This may be something that if a loved one wants to do, regardless if it's the cerebral palsy, there is the published stuff regarding, was that published regarding the blindness?
I'm not sure if that one's published. I believe he might have one Dr. Todd has one published with Parkinson's, I think.
Parkinson's?
I think he has one published with Parkinson's.
Obviously, the congestive health.
That one's
failure,
published.
Fully published.
There's one with the anti-aging aspect that's published.
And then was there anything published regarding the ligaments at all? Or
I didn't. That's what he wants me to submit all that, and I just haven't gotten around to submitting it to him.
It takes
time, and
and you're a busy guy, and you got a lot of jiu-jitsu to do. So.
But that would actually probably be. I should probably just hire someone to write it for me. You know what I mean? Because I can give them all the information.
Right.
But yeah, that would probably be a great article to publish.
Yeah.
So.
No, it's I would suggest you write it yourself, because that is the best way to communicate your study.
Right.
On it from first person, and then you take first authorship on that manuscript. But nonetheless, this is some really, really incredible stuff. And me, I'm uber skeptical. I
am too.
No. And you have to do this, because that's the responsible thing to do. But these types of results, like even with the video here, that if that was your child, you would want nothing but the best for them. And he achieved his goal. Yeah. And that was with one round.
Right.
So again, there's no promises being made or anything like that, but just being able to go and have a normal life, to be able to go and do what everybody else is doing, especially as a child.
Yeah.
That's look into this further. So just to kind of go and wrap things up, where can somebody find you, Dr. Neil Morris, or even, do you feel comfortable in referencing Dr. Todd as well? Like, is there like a consortium of people across the nation?
Yeah. So last I heard, and I'm not 100% sure, last I heard, there are 32 places in the world that you can receive this treatment. We were the 28th to be able to do it. There might be a couple more now. I probably will head out again this fall, back out to Carlsbad. Dr. Todd is all over the place. So literally I don't know if he's back from it yet, but he was actually at the Vatican and talking there was a discussion there that he was actually invited to go to. So he travels all over.
So he probably doesn't see patients.
I don't know if he actually sees patients anymore, but he does have a clinic where you might be able to receive treatment.
Gotcha.
I'm not 100% sure. I don't know if he actually still sees patients. He does educate. He does teach. He teaches a lot. He taught my certification, and also whenever I went back the following year, he also was a part of that continuing education also. So this year, every time I see him, I find out so much cool stuff he's been doing in the past year and what's new on the docket. And he'll say, this is what's going on. You can't talk about it because, it's still under research type of thing.
Sure.
So there's tons and tons of cool research that he's always working on. And some of it is happening in Israel. He's doing some research. Last time I talked to him, it was in Israel, and it was with the V cells. And last I heard, the results were really, really good. So I'm looking forward to seeing him again. So yeah, I would say, can be difficult to reach, but potentially is reachable.
Gotcha.
I don't know how easy or hard he is to reach for someone who's not associated with him like how I am.
Gotcha. So let's just forget Dr. Todd.
Yeah.
And let's count on you because people can reach
And
you.
there are other places in the United States. I believe we're the only one in Arizona. There is a place in Florida. Last I heard, the gentleman in Florida, he was booked 3 months out.
Gotcha. But if somebody wants to do this and they want to fly into Arizona,
Yeah.
you're more.
We're in Mesa, Arizona, which is right next to Phoenix. If you don't know where Mesa is, you can fly into the Mesa airport. There's also Mesa Gilbert Airport. But the big airport's the Phoenix.
Yeah, Sky Harbor and stuff. So easy to get in, get out. But nonetheless, all of your contact information is provided as a part of this episode. So go and check them out on the web at restorehealthaz.com and just go and shoot your questions. And to be honest with you, if you guys have any questions regarding this, feel free to go and post them on this episode. And somebody will either through the Decoding Health podcast or else Dr. Morris himself will be able to come back and address them too and provide information looking at it. And again, for people who are naysayers and skeptics regarding this, and I'm sure
I am.
No.
I've always been.
But you got a lot of keyboard jockeys out there who think they're they've got angles on things.
They looked it up on Google.
Yeah, but even the whole concept of this being a proprietary technology being used in early clinical practice, because this is partially R&D, but there is full consent, informed consent being provided, and appropriate people are signing off on this. This is actually standard and common across all aspects of medicine. There are proprietary techniques that are used in dentistry and orthopedics, like carpal tunnel. Holy geez, there are so many proprietary approaches in terms of doing carpal tunnel. And you can only go to specific clinics because they're the only ones that are certified to do that technology because somebody else does own them. That doesn't make it bad or scammy or anything like that. It's the nature of the business of science and medicine. Yeah. It is what it is. So
it protects Dr. Todd. Really.
No, absolutely.
You know what I mean?
Absolutely. So if you guys have questions, throw them out there. Love to start a discussion on this because this stuff, the video, these case studies are absolutely incredible. And in my view, this is just the beginning. So, hey, Dr. Morris, thank you very much for being on the show.
Thank you for having me.
This is a lot of fun and looking forward to seeing more and more stories like this coming through. So, awesome. until next time, you guys know where to find us. Tell your friends. This is some absolutely incredible stuff. So we'll see you later.
Individuals looking to unlock their true potential should look no further than Restore Health AZ. Whether someone is an elite athlete or a high performer in their industry, Restore Health AZ is there to help them reach new heights. Their groundbreaking restorative injection therapy and anti-aging precision medicine are designed to rebuild health naturally. At Restore Health AZ, they believe in the power of biohacking and regenerative therapies to optimize performance and longevity. Their innovative approach includes treatments like V-cell therapy, which harnesses very small embryonic-like stem cells to promote tissue repair and rejuvenation from within. For those who won't let pain hold them back, Restore Health AZ offers a solution. Interested individuals can visit restorehealthaz.com to take a pain quiz and get a free 10-minute consult with one of their experts. They can experience the future of medicine and revitalize their performance with Restore Health AZ.